Hey community, this is Dr. Hugh, and today what I want to do is I just want to expand on the autoimmune conditions. I did a video last time, it was on autoimmunity and antibiotics and how antibiotics can produce autoimmune disease. So today what I want to dive into is how autoimmune disease can be actually attacking your brain and attacking your neurological tissue. I do believe that a lot of people that come to see me are suffering with some kind of autoimmune disease that's very specifically going after your neuronal tissue. So let's dive into this so to give you some understanding of what you can do about it and how you can actually test to see if you actually have this happening in your body right now. Okay, so first thing here is autoimmunity against your brain. Is it possible? It is possible, and it's probably highly likely, especially if you're having symptoms of neuroinflammation. So what are the symptoms of neuroinflammation? So neuroinflammation is a fancy word for saying that your brain is on fire. So when we talk about your brain, it's not like your brain has pain senses in it. So it's not like, it's like if you hit your thumb with a hammer, it's going to say ouch. Your brain doesn't have pain like that. So what your brain does is instead of having pain, you get brain fog, brain fatigue, mild cognitive impairment, depression. These are the things that can indicate that you have an autoimmune disease against your brain. So if you've had a lot of antibiotics, if you've had a lot of drugs, these drugs can actually cause autoimmune disease in your body. That's proven research, and I go over that in my last video. So this is subtle brain inflammation right in here. So brain fog, you notice things in your mental speed, you're not as quick, reduced endurance, chemicals will cause irritation to your brain, and you won't become you'll be less focused. Specific foods, here's moderate depression, sleepiness, fatigue, lack of motivation, appetite, malaise, and here's severe damage right down here. So any of these is a possibility, but if you just know that you're not thinking clearly, you definitely have some kind of brain problems, and you might have autoimmune disease. Now, once you have an autoimmune disease, you have that forever. What you try and do functionally through a functional medicine program is do a polytherapy approach to reduce that inflammation, to reduce the autoimmune disease against your body. So if you're out here listening to this video and you get one clinical gem, give me a thumbs up, subscribe to my station. There's a lot of content out here. So we need your thumbs up and subscriptions to actually boost this content because there's too many people that need some help. So this is your brain. Okay, so what happens here? So this becomes a flag. I'm just going to put a flag right in here. So what happens with autoimmune disease is your brain is now flagged. And when it's flagged, your immune system sees that flag right there, and then it starts to attack the tissues. There's little Pac-Mans that go around here, and the Pac-Man start to eat everything. Right here would be a Pac-Man, poor Pac-Man. But this would be a Pac-Man. It goes around and eating the tissue. Why is that? Because it's flagged right here. So your immune system has flagged your tissue, self-tissue, as foreign, and then your immune system sees that, and then it goes and starts to eat it. This is when you get an autoimmune disease, and this is when your symptoms can come and go because your autoimmune flare-ups can come and they can go, right? So this is the weird thing about autoimmune disease is they're unusual symptoms because they can flare, they can come and go. Now, if you didn't know this, 1 in 12 women are diagnosed with an active autoimmune disease. 1 in 12 women. So autoimmune disease is very, very prevalent in this country, in the United States. We roughly spend twice as much money on autoimmune disease as cancer, right? So autoimmune disease is very, very prevalent. And so now let's see here, we have your myelin sheath. This is the myelin sheath right here, and this is what's happening when you have an autoimmune disease. So this myelin sheath is flagged, right? Let me just put a big flag right there. Let me put a flag right here. So there's a big flag right in here. So there's a big flag right here, and this is flagged right here, autoimmune disease, and then your body starts to attack it. So here's some testing that you can do. This is some advanced testing. This is through Cyrex Labs. Now, check out, this is called an Array 5. This checks for global autoimmune disease, because if you have one autoimmune disease, you probably have 3 or 4 other autoimmune diseases in your body. So you just never have one. So you really got to look at, if you have one autoimmune disease, where's the rest? Where's the rest of the autoimmune disease? So this test here checks for multiple autoimmune reactions. It checks a lot of different things. So it's checking tissue. Like we know, for example, what your collagen tissue looks like. So do you have antibodies against your own collagen? A lot of people have fibromyalgia. They have knee pain. They have elbow pain. They have neck pain. Maybe you have an autoimmune disease against collagen. But in this video, we're specifically talking about your brain. This is why this test is so powerful, because it checks all these different markers right here. So for this video, we're just going to be focusing on these things right down in here. So this would be normal. The green is normal. Anything outside the green tells you that it's a problem and you have autoimmune disease. So this is one case right here. You can see how many markers they have. Now here's another case down here. All these things here in the yellow and in the pink are autoimmune disease. Your tissues are marked as foreign and they start to attack it. So what I really want to focus on is really these markers right in here. So you can see here, we have 1, 2, 3, 4, 5 specific markers for nerve tissue. So you can see, let me just blow this up here. Demyelination disease, chronic inflammatory demyelination disease, cerebellar, this is your brain right in the back of your head right here. Autoimmune disease against that, cerebellar degeneration, so dizziness, shaking, poor balance, poor cognition in your brain is all signs. Synapsin, which has to do with the neurotransmitters, demyelination disease. So we get a lot of data here by this test. Now here, you can geek out in here. This is what all these different things check right here. You can stop the video and you can see exactly what happens here. Like here's adrenal glands, autoimmune disease against your adrenal glands. Here's like a lupus, autoimmune disease against your phospholipid membranes. And here's the second part of it too right here. So you can stop the video and check this out. They're all referenced. Then here's another test. You have autoimmune disease specifically against your blood-brain barrier. You've heard leaky gut. You can have leaky brain. You can see right here, this is one of my patients out of range. So they have leaky brain, which means this is the brain tissue right here. And this is the blood. That means that things from the blood are leaking into the brain, causing inflammation. So this is to check the blood-brain barrier. And up in here, these things actually check certain tissues in your body. So a lot of people want to know, what can I do about it? What can I do about it? There's not one solution. Autoimmune disease is very, very complex, and you need to take a polytherapy approach. So all these things, vitamin D, homocysteine, A1C, fasting insulin, food sensitivity, stomach acid, all these things right here need to be checked and figured out. Do you have any of these problems? What problems do you have? And how do we normalize these problems? So at the end of the day, if you're looking for help down below, there's a link to reach me for some help. And I hope this brings some value to you. Give me a thumbs up. Subscribe to my station, and remember, where there's help, there's hope. Take care. Bye-bye.